Very good afternoon to you, dear listeners. This is SSBC live from headquarters in Ukraine with me, Alex Kalwadaks, presenter on the weekend. Today we are going to talk about trauma healing. As I was joined by an expert that will talk specifically about the topic. And you guys, we are also delightful to tell you that please do follow us online and also do open your radio and be part of this beautiful program because this program is actually talking about the area that are affecting us. Allow me to also to welcome my guest, that is David Dakcha, the health expert in trauma. Welcome to the program, Dak. Pleasure to have you.
Thank you so much, Alex. It is my pleasure today, and I really appreciate SSBC for inviting me to talk to our people regarding trauma.
Right. As we jump into the topic, briefly, what can you highlight? Can you highlight for us about the cause of the trauma? Because we believe that there is a root cause of that. So can you take us through briefly?
Thank you so much. Before I take us to the cause of trauma, first of all, we need to know what is trauma. The word trauma was derived from ancient Greek word trauma, which means injuries in the mind or wound in the mind. And trauma, it is emotional, psychological, and physical, deeply distressing event witnessed by a person, or you have experienced it. And of course, there is a lot of causes that cause trauma. One of it is violence, and we have conflicts, war, we have natural disasters, and also we have accidents or severe injuries. Even domestic, violence is one of that cause trauma. When it comes to the level of trauma, of course, many South Sudanese are affected because, as I said earlier, it is either when you experience it or when you witness it. And all of us, almost all of us, have experienced conflict or violence or war. Then 1% receive trauma healing. It means all of us are affected.
It's okay. So what can you tell us briefly about the treatment? What treatment is the best for trauma as an expert?
Thank you. The good thing, trauma is treatable and it can be managed. And one of the best and the major treatment is what we call CBT, that is cognitive behavioral therapy. And this one, only the expert, the psychologist, and the counselor can apply it. Whereby when a traumatized person seeks counseling, and sometimes the expert may, depending on the assessment and diagnostics, there are talk therapy that can heal the person. But if it is a severe one that needs medication, now this leads to psychiatric cases whereby some medication need to be prescribed to the person affected by trauma. There is a big myth here whereby people, when they see a traumatized person, they connect it with traditional and witchcraft because, people have lack of understanding what the person has gone through. And of course, this is not true because a person may have experienced it, a terrible situation. And this one, we cannot say it is a witchcraft or connected to the witch doctor. Because the country now, we are not yet having like centers and consultancies for mental health and also for counseling. That's why a bigger population is not aware on how to manage trauma and how to identify a person who is traumatized.
So, since you mentioned that you touched the good point that said we don't have a center that can identify the person with the trauma. Based on your experience as an expert on that piece, and for how long are we going to, to continue without having a center? So what advice can you give on that?
The Ministry of Health have to work hard on this because we have a department of mental health, whereby this department have to put a lot of effort to make sure that our people they need to receive these services. A talk show on radio like this, it is very important so that we can talk to the people on how we can heal from trauma. And also they need to come up with a strategy to set up centers for mental health, whereby that can be accessible by anyone. Because now the help we are receiving from organization here, it is not enough. Minister of Health, with the Director of Health and Director of Mental Health, need to come up with a strategy to make sure there are counseling centers and mental health centers that should be accessible by anyone. And awareness on this topic regarding trauma and mental health in general need to be, to be given out on either SSBC or radios, so that people are sensitized on how also they can be, they can cope, they can live, they can move on with the daily activity.
Well, do you think that now what make this trauma situation increasing increasingly every day? Do you think that is a lack of awareness?
Yes, lack of awareness contributes, and stability also in the country is the biggest measures, because if the country calm down, maybe if there is no more conflict, no fighting, this situation will calm down, and people also will seek help. Lack of centers, it contributes, because now if I need help, as I said, there's nowhere to go to.
And based on your assessment, based on your reading, so what could you measure that make these people to fight easily, though it's something that they could not fight? What lead them to that emotion? Do you think that it is an environment impact that contribute to their health status?
Well, the country, we are in war for many years, and this affects people a lot. And besides that, economic crisis contribute to the country, and insecurity also contributed, and natural disaster also contributed. Lack of job from youth also, this contributed. And now it is not easy for anyone, to move on with life when you lack a certain thing, a certain need that you need. So now if there is a stability in the country, people will go farming, maybe because a lot of youth now, they are jobless, and that's why they are, grouping up. There are gangs, there is a lot of Toronto everywhere. This is the lack of job. If there are companies, if there is, a lot of job for the youth to go and participate, there will be no room, for you to go and quarrel or fight anyone. You will be stable mentally. But if you are not stable mentally, you will be disturbed. Even your response, your reaction will be negative.
Right. As an expert, here there is the World Health Organization. The World Health Organization estimates that 20% of people living in conflict affected area, experience the mental health condition and trauma. What's your reaction then on the World Health Organization?
This is very true, because
do you believe the figures?
Yes, I believe the figures.
So what give you confidence in that figure?
What gave me the confidence of the figure is because many parts in South Sudan are affected by war. And as I said earlier, based on the definition, trauma, it is based on when you experience or you witness. It means those areas affected by war, either you have experienced it or you have witnessed. And now, in this trauma condition, it needs us to lay a strategy, as I said before, for trauma healing. Because now it is already a condition, we need to come out from that. So I believe many people, or the biggest population in South Sudan, need healing from trauma.